Good afternoon, everybody. Thank you so much for joining us. I am Kelly Caseman. I am the Executive Director of Think Kids, and today we're going to have a data-driven discussion to understanding child maltreatment in West Virginia. As you know, it's Child Abuse Awareness Month, and I know a lot of people out around West Virginia who want to do more to decrease our rates of child maltreatment in West Virginia. We find so much misinformation out there, and folks aren't sure where to go to get accurate data. So we thought this would be a great way to try and coalesce around the issue. And we have Robert Peters with us today. He is the president of the SHIELD Task Force. Robert, do you want to tell us a little bit about yourself?
Yeah, great to be here, Kelly. Thanks for having me. As you said, my name is Robert Peters. My day job, I'm senior attorney at the Zero Abuse Project, also founder and chair of the SHIELD Task Force, former child abuse sex crime prosecutor in a couple different jurisdictions in West Virginia. Also work with NW3C, the National White Collar Crime Center, as their senior cyber and economic crime attorney. And then I've also interfaced with the issue of abuse as a foster and adoptive parent. So I had a lot of experiences from a couple different angles on abuse in West Virginia, and great to talk about these important issues. Thanks for putting a spotlight on them, Kelly.
Well, thank you for being our resident expert. I feel as if we are all in good hands with you with us today. And then we usually have Maddie Lavoie, who is our intern extraordinaire at Think Kids. She's not with us today. So in her place is the wonderful Andrea Dar. Andrea, you want to say hello to everybody?
Hi, everybody. I'm going to monitor the Facebook today. So if you have questions and concerns, please put them in the chat and we can address them. Thank you.
Thank you, Andrea. And so we're going to get started. We're going to show a PowerPoint presentation because a lot of what we're going to be sharing today is data and statistics from a couple of sources. It's going to be hard for you to see. And so we're going to be sharing links to all of these data sources after this event. And we're going to try and read some of them out loud to you. But we completely encourage you to go to these data sources, make a bookmark of them, and keep them as you progress in your efforts to try and advocate for West Virginia's kids. So let's get started. The goals of today's Facebook Live is to identify credible sources of data on child maltreatment that can better and more accurately inform our work collectively here in West Virginia. Encourage those who may want to expand their nonprofits programming to include supportive community programming. And so, you know, often when you write those grants, you need data to illustrate the statement of need. And so this data will be really helpful to you. And then cultivate a wider base of advocates to address child maltreatment in West Virginia. You know, we want to ensure that there are community programs and services throughout the state. So families and kids have access to what they need to thrive as they grow up in our state. And so with that, let's jump in on how child maltreatment is reported. The National Child Abuse and Neglect Data System, or NCANS, was established in 1988 as a voluntary national data collection and analysis program to make available state child abuse and neglect information. Data have been collected every year since 1991 and are collected from child welfare agencies in 50 states, including the Commonwealth of Puerto Rico and DC. And so if you Googled National Child Abuse and Neglect Data System right now, this is what you would find. You would find the front page of NCANS, and it's part of the Office of Administration of Children and Families under DHHS. And so this is the report we're really going to be focusing on today. It's Child Maltreatment 2019, and it came out just a few months ago. And it's important to note for those of you who are newbies in collecting data, it takes data a couple of years to be collected, analyzed, and reported on. And I'm not sure what's going to happen in 2021 in regards to collecting and reporting information during the pandemic, but we'll see, right? So the numbers that are reported in this report, the national rounded number of children who receive a child protective service investigational response or an alternative response, which we'll discuss in a little bit, decreased from around 3.5 million for federal fiscal year. So that's October 1st to November, September 30th. So that's federal fiscal year 2018 to 3.476 in federal fiscal year 2019. So that's good news. The rate of child maltreatment in our country is going down. The data show more than 4/5 or 84.5% of victims suffer a single type of maltreatment. 61% are neglect only, 10.3% are physically abused only, and 7.2% are sexually abused only. More than 15% of our victims are 2 or more maltreatment types. And I'm going to pause here. Robert, we talked about this earlier. Do you have something to add to that?
I do, yeah. I think maybe one of the themes that we'll encounter today is maybe the concept of silos, or perhaps efficacy of data collection, and maybe efficacy of investigative efforts in many ways. And I think this second bullet point is one example of that. So the 2019 data on polyvictimization is just not consistent with what we know from studies of how victims experience abuse. Specifically, if you look at the literature on polyvictimization, 2/3 of youth who have been abused in one way, say sexual abuse, 2/3 of them have also been abused in another way, say physical abuse, neglect, psychological abuse, whatever the case may be. So that's not reflected in this report, and I think there's a couple of reasons why that's likely to be the case. First of all, we should look at investigative efforts themselves. So we teach the Child First Forensic Interviewing Protocol in my day job at Zero Abuse Project. I'm currently on my lunch break, but at Zero Abuse Project, that's the Forensic Interviewing Protocol. It's one of several excellent forensic interviewing protocols at a national level that's in over 20 states. That's the most frequently utilized forensic interviewing protocol, including in West Virginia. But one of the things that we teach is you don't, as investigators, as forensic interviewers, or as CPS workers, you shouldn't fixate on a single form of maltreatment. You shouldn't have that tunnel vision entering into a forensic interview with a child specifically. Instead, you cast a broad net, you assess for a broad range of potential maltreatment, and then based on the child's disclosures, you do some digging into each of those specific areas. But you don't have a preconceived notion of, oh, there's an allegation of this form of abuse, well, we're going to go right there. We stay open-ended, we stay non-leading, and we assess for all potential forms of maltreatment. So what this suggests to me is that clearly, to some extent, either at the data collection phase, or at the interview phase, or at the interview documentation phase, somewhere that's being lost, because we do know that study after study, victims are abused 66% of the time. There is that poly victimization. So there's some work to be done there, certainly.
Thank you so much for that, Robert. And you all can see now why we invited him to join us today. So thanks for that. Moving on, for federal fiscal year 2019, a national estimate of 1,840 children died from abuse and neglect at a rate of 2.5 per 100,000 children in the population. The 2019 national estimate is an increase from the federal fiscal year 2018 national estimate. And so while we see the reporting of abuse going down, we see the fatalities going up. So this is, again, one of those charts that is hard to read. So I'll read the number out to you. And then, of course, I highly recommend you download the report and look for yourself. And one of the reasons we share this child population number, is because we want folks to get a context when we start talking about rates of how many kids are in West Virginia. But we also wanted to show the loss of population that we're experiencing. So in 2015, between the ages of 0 to 18, there were 378,115 kids in the state of West Virginia. And in 2019, there were 359,567. So within those 4 years, we lost around 20,000 kids, which is substantial. And I think that's something worth noting. And I also want to share this too, because for you fellow grant seekers, sometimes you may see that the numbers are different and different things that are reported. And what you quickly find is that people will lump different groups in, like 0 to 17, or 0 to 21. And that 0 to 18 is really kind of the number that we focus on at Think Kids. And so it's kind of a handy chart to keep when you're trying to talk about numbers and a variety of health disparities. So Child Maltreatment 2019 presents national data about child abuse and neglect known to Child Protective Services agencies in the United States. The data is collected and analyzed through NCANS. Because NCANS contains all screened-in referrals for CPS agencies that receive a deposition and those that receive an alternative response, which we'll talk about in a few minutes, these data represent the universe known as CPS child maltreatment cases. Approximately 60 data tables and exhibits are included in this report. And so it's important to note there's a lot of data in there that we're not going to talk about today that could be really important specifically to the work that you're doing. And then I'd like to talk about the statistics at a glance, because I think this is important. I find a lot of kind of myths and misconceptions about the way CPS numbers are reported in our state. And so this may be really helpful to you. I know it's helpful to me. So on a national level, there are about 4.378 million referrals alleging maltreatment to CPS involving children, involving 7.8 million children in the United States. 54.5% of those referrals are screened in, which means they become reports. 45.5 referrals are screened out. Okay. Of those reports received, there 2.368 million receive a disposition. And we're going to go into who is making those reports in just a minute. 3.476 million children receive either an investigation or an alternative response. So of those children, 656,000 are considered child victims, which we'll discuss that again in a little bit. And then 2.82 million are considered non-victims. And they receive post-response services when they're available. And then 57,681 non-victims received foster care services. And so there's a whole process when we talk about child abuse and neglect cases as to what's referred in. And it's important to note through this screening process, the numbers that we're going to share are those who were screened in. And so I often hear people say when we talk about our high numbers of child maltreatment in West Virginia, that it's a lot of it's a lot of calls that are made that are screened out, but that's not necessarily the case because NCANS doesn't keep or report on the numbers that are screened out. It's those that are screened in. So a referral may be either screened in or screened out. Referrals that meet CPS agency criteria are screened in and receive an investigation or an alternative response from the agencies. Referrals that do not meet agency criteria are screened out and diverted to CPS from CPS to other community agencies. Now, here are some of the reasons why screening out our referral process. Just a second. Reasons for screening out a referral vary by state policy, but here are some of the main reasons why they're referred out. It doesn't concern child abuse or neglect. It doesn't contain enough information for a response. Another agency is deemed more appropriate to deal with the referral. Children in the referral are the responsibility of another agency or jurisdiction. And the children in the referral are older than 18 years of age. And you'll see some national rates over in the charts on the right.
If I could jump in once again, Kelly, I think one thing to remember in that screen in, screen out process is it's not determining necessarily the veracity of the allegation, right? So for example, if a perpetrator is out of the home, let's say a sexual abuse case where a perpetrator is out of the home, well, that's not typically a type of case that CPS will have jurisdiction over. Typically, that's something that's going to be more of a law enforcement nexus is more appropriate. That doesn't mean that the allegation is false. I'll talk a little bit. I dealt with a defense expert witness who tried to make that argument that screened out equals false. That's not the case. It's just simply categories for CPS processing.
Thank you, Robert. Andrea, let's turn to you for a second. Are there any questions online?
No questions right now, Kelly.
Okay, thank you, Andrea.
You're welcome.
Let's move on to reporting sources. So only sources in reports, like I said, are screened in referrals that received an investigation or an alternative response that are submitted to NCANS. Again, education personnel are the largest source of referrals, and that is at 21%. Second is legal and law enforcement personnel at 19%, medical personnel at 11%, social services personnel at 10.3%, and mental health personnel at 6%. And then there's other folks at smaller percentages. So this is really meaningful to me because I hear really often that I think I heard over 50%. Robert, please correct me if this is correct information and it's a different reporting site, but around 55% of CPS calls in the state are from education teachers, and often they're considered as unsubstantiated.
Yeah, there's a stat from USDHHS in 2018, and I saw it in Darkness to Light materials. So I haven't looked at the underlying study, but that stat was that 52% of confirmed cases of child abuse were reported either by educators or by education adjacent personnel. So clearly there's some discrepancy between that figure and what you have here, which would be interesting to delve into.
It would be. Thank you. Thank you for that. But I think that we don't want to disparage our school staff from and say that they overreport. They do go through training, correct, in order to become mandated reporters. And go ahead, Robert.
Yeah, they should. So you have the Aaron's Law, and this is maybe jumping ahead to a soapbox I have later on, but I'll at least preview it here. I think one of the issues one of the questions I have is how thoroughly Aaron's Law has been implemented in West Virginia in the last few years, but particularly during the pandemic. So one of the things that SHIELD Task Force does is provide staff training as well as student training that satisfies the mandates of Aaron's Law. Aaron's Law mandates age-appropriate abuse prevention education, K through 12. It also mandates staff training on issues like mandatory reporting and dynamics of offender strategies and victimization and things like that. So my question would be, how thoroughly that's been implemented during the pandemic. Anecdotally, I think the answer to that's probably pretty discouraging, just based on anecdotal evidence, but I don't know of any comprehensive effort to collect how many counties are truly implementing Aaron's Law during the pandemic era. I think that's a really important question.
That's a great question. And I would love to know if there is a source that is collecting and assessing that information and will be disseminating it out. So moving on to state stats for screened in and screened out referrals, you'll see, like on previous charts, the red circle highlights West Virginia stats. And so we have 62.8, a 62.8 rate of screened in, or I should say that's percentage. It's different. It's important to denote the difference between rate and percentage. So 62.8% screened in, 37.2% of referrals are screened out. And we have the fourth highest rate of total referrals at 119.1, excuse me. And so we have a pretty high rate, which is kind of consistent with some of the numbers that we'll see in a few minutes. This is concerning statistics, and I hope you have some thoughts on this, Robert. So this is the average response time in hours to a referral that has been screened in in 2015. The average response time in hours in West Virginia was 71 hours, and then in 2019, the hours are 339. And so we see a significant uptick in the number of hours before there's an actual response. Do you have any thoughts on that, Robert?
A couple. First of all, if you're looking at this time period, it'd be interesting to see a little bit prior to 2015, but this is the time period where abuse and neglect caseloads across the state exploded. And so this is a time where CPS caseloads in particular were certainly under stress. I know of workers who had triple digit caseloads, which is, conservatively quadruple the recommended max at a national level. So I imagine that might be playing into that to some extent. There are mandated response times. My assumption here would be that probably there was some triage where if you have a severe allegation, that was triaged to respond fairly quickly, whereas some others were triaged and had a significantly longer response. I do know I have to be careful what I say. I do know of some instances where the volume was such that there was prioritization placed on cases that had already made it to the court system and were under judicial oversight. So you had a bit of a backlog, at least in some jurisdictions. So yeah, there's a lot of concern there, and I think that speaks to the need to resource. I think the temptation, not to jump on yet another soapbox, but I think the temptation we often have is to sort of attack an individual, an individual frontline worker. And that's rarely the issue, right? The issue is much more so the systems, the resources, the prioritization. And in this case, this was just a staggering time of increase on civil abuse and neglect dockets in particular.
I would agree. It's, working as a children's health advocate during this time period, it was almost like a tsunami to me that we saw this. This is when the opioid epidemic really started to explode in the state, and yet we seemed to lack the capacity to understand that there is this tidal wave coming when it came to all systems that are specific to children, right? So this is when school systems started to realize a significant number of adverse behaviors, kids needing mental health care. The healthcare system started to realize the overwhelming need for mental health care that was not available in the communities. Foster care started to, see this incredible uptick. And then, of course, child welfare did as well.
And I think some of what this demonstrates is the scaling of resources and the scaling of personnel was too slow. It was too slow, and it certainly wasn't proactive.
That's a good way of putting it. Thank you, Robert. So speaking of workforce, here are some stats on the intake of screening workers, investigation alternative response workers, and then a combination of both. So collectively in 2019, we had 349 workers, 41 were intake and screening workers, and then 308 were investigation alternative response workers, which again, comparatively to other states is relatively low considering the volume of kids that we had introduced into the child welfare system. So let's move on to child disposition. What does that mean? Because you see it frequently in this report. In most states, the majority of reports receive an investigation. An investigation response results in a determination, also known as a disposition, about the alleged child maltreatment. Two most prevalent NCANS dispositions are substantiated, unsubstantiated, and then alternative responses. And I've mentioned that a couple of times. That's characterized by an emphasis on an assessment of the needs of families and children with little emphasis on determining if a specific incident or condition of maltreatment occurred. So that is kind of diverting children out of the system and trying to address a need or service within the family. And so child disposition rates, you see, actually have gone down, as we stated at the beginning, over the last 4 years. And the rate is 5.6%, or I'm sorry, 56.5 unsubstantiated cases, which is again rather high when you start talking about dispositions. I hope I clarified that. Do you have anything to add, Robert?
Yeah, I think I would double down on the distinction between unsubstantiated and untrue, because that's, again, a common misconception that's floated out there. To give you an example, encountered a defense expert back when I was a prosecutor who tried to make that false equivalence. Now, in fairness, this individual, this expert, I should probably include with quotes, he had a website called abuseexcuse.com. So he was pretty transparently on the defense side of things. He in his pitch to potential clients, he offered advice to those whose, quote, hands may wander or whose tender bath may send them to prison. So I say that as pretext. But he made that false equivalence, saying, look, there's a tidal wave of false allegations. Look at all these false allegations that are unsubstantiated. And the word unsubstantiated sounds bad, right? It sounds like, oh, we looked into it and there's nothing there and it's false. That's not necessarily the case. Remember what we talked about when it comes to CPS caseload. If you've got 100 cases, and hopefully that's no longer the case anywhere in West Virginia, but at one point that was the case, at least in some jurisdictions. If you have a triple-digit caseload as a social worker, it is impossible. It is impossible. You could be the greatest investigator the world's ever seen. You can't even achieve. You don't have the resources. You don't have the resources to do a thorough investigation at that point. So that's one asterisk to put out there. And again, it certainly doesn't mean that the victim report is necessarily false. It could be an issue with obtaining evidence, or there could be some other issue. I think of a case I had where a particular teacher made 17 CPS referrals, and it took 17 for the case to finally make its way to my desk. Now, one of the common misconceptions is, oh, CPS isn't doing anything with it. That's not necessarily the case. There's a lot of things that go on behind the scenes that the general public isn't privy to. But in this particular case, there truly wasn't a lot of movement on that case, despite this teacher's persistent concerns. That didn't mean that teacher had a 1 in 17 rate of accuracy. It didn't mean that the child who was making disclosures was a liar. It meant that there were limitations that prevented thorough evidence from being collected. So that substantiated rate doesn't equal the validity of the reporter or the validity of the victim. In fact, in the case I'm thinking about, it turned out to be one of the worst cases I ever prosecuted. It involved torture. It involved sexual abuse. It involved at least one death, not of a child, but it was a really, really dark scenario. And there were months that went by where, other things could have occurred. So I say that to make that quick limitation. I also think we need to remember when we're talking about reporting, and maybe this is more relevant to the screened in, screened out conversation than to the substantiated, unsubstantiated conversation. I don't want to cross wires here. But there's an important article by my mentor and colleague, Victor Veith, who's the Chief Program Officer of the Zero Abuse Project, and it's called Unto the Third Generation. And in this, Victor lays out a plan, a 120-year plan or a blueprint for how you would go about actually drastically reducing, indeed eliminating child abuse. And that sounds utopian, but it's not. And his approach is not utopian. But one of the things he points on is this issue of reporting and the fact that most people don't report abuse. So Victor cited a study where members of the public were exposed to evidence of abuse. And in that study, only 26% of them actually reported at the first disclosure of abuse, and another 11% reported the second time. So most people don't report abuse. And I want to add to that, my concern, quite frankly, is much more with teachers not reporting serious abuse than with reporting things that might not be worthy or merit a full CPS investigation, quite frankly. I think that goes to proper training. We do need to ensure there's proper mandatory reporter training in all counties. We need to be very careful about issues of bias, systemic bias, racial bias. Those are absolutely legitimate issues that do exist, and we need to focus on those. But with that said, I'm also concerned about the fact that within the past few weeks, I did a training for teachers in West Virginia. And when I presented a hypothetical where a student comes forward to a teacher and unambiguously discloses sexual abuse, in one of these trainings, a teacher is asked what she would do, and she said, "Oh, I would tell that student to go find a trusted adult." that you are the trusted adult. You are the trusted adult in that situation. And so clearly, there is an issue when it comes to mandated reporter training and the need to report much abuse that isn't currently reported. Another thing I would point out is that just because an allegation is unsubstantiated, it's not invalid, as I've said. But one data point on that would be a Missouri study where approximately 80% of their child maltreatment reports were not substantiated. But 3/4 of them included victims that later returned to the attention of the child welfare system and were substantiated. So quite often it's looking at about the right data set. There's just, again, limitations in evidence collection and other things. So that's a bit of I went down the rabbit trail there a little bit, but I think it's important to have that understanding and the importance of dealing with each of these reports with excellence.
I think that's incredibly important. I'm glad that you share that because, as somebody who works rather frequently with school staff and school-based health center staff, I've experienced significant burnout of them saying, I've reported frequently and nothing ever seems to come of it. And so I think that often it's considered an unsubstantiated report, but it's due to lack of sufficient evidence. It's not that there isn't something valid that could potentially be going on there. And so, I think that, again, we've heard the same thing. Some folks disparaging our school staff from reporting where perhaps they just need better cross-training with CPS to understand the process itself.
Yeah, and this is maybe even a bit further afield, but I think on the lack of evidence piece, one thing we teach in zero abuse projects, prosecutor institutes, and other trainings is that corroborating evidence does exist in every case. Might not be able to meet the relevant evidentiary threshold in a criminal context. It might not be beyond a reasonable doubt, but corroborating evidence of abuse in a valid abuse allegation, which is most of them, does exist in every case. Likewise, digital evidence does exist in every case, but the issue is our front lines aren't resourced adequately. They're just not resourced adequately. And I think oftentimes, I've been in courtrooms where these poor CPS workers, they're out all night every night, and they might get beat up on by different systemic actors. It's not on them. It goes to adequate resourcing and adequate training.
Agree. So let's move on because I'm eager to discuss some of that ways that we can better target some of our resources in the state. So this is probably one of our more important points to make. What is a child victim? It's a child who the state determines at least one maltreatment or substantiated claim has been indicated, and a disposition or substantiated indicated was assigned for child in a report. So this includes a child who died or the death was confirmed by the result of child abuse and neglect. A child may be a victim in one report and a non-victim in another report. The number of victims decreased nationally by 4% from 2015 to 2019. At the state level, the percent change of victims of abuse and neglect range from 62.5% decrease to a 100% increase, depending on the state. And something that was rather alarming to me when I started delving into this data was how high the number was when we're looking at victims by age. 25.7% are kids under the age of 1, which is startling. The stats are the rates of child victims. This is again hard to read, so I encourage anyone watching this to download the report. But what you see is a shift up in the state of West Virginia, and then a bit of a shift down in the number of child victims. So to the left, you see the sheer number, and then on the right, you see the percentage. So the percentage change from 2015 to 2019 in our state was 38.5% increase. In 2015, the rate per 1,000 children was 12.8% per 1,000 kids. 2019, that is 18.7 per 1,000 kids. And so we have the second highest rate of child victims in the country, second only to Kentucky. Which is disturbing but true. And then we look at first-time victims. West Virginia has the highest rate of 15 per 1,000 children who are a first-time victim. And what a first-time victim is states are instructed to check whether there was a disposition date of substantiated or indicated associated date with the child prior to the disposition date. And so they look at the records of another substantiated claim. And so if they don't, if they don't have a substantiated claim, they're considered a first-time victim. And we have the highest rate of kids who are considered first-time victims. Anything you want to add to that, Robert?
Yeah, well, there's a variety of ways we could go. I think it's important to remember, this. I don't know. It'd be interesting to see sort of the breakdown in first-time victimization by abuse categories. So, for example, if we're looking at sexual abuse victims, there's some interesting studies on that. The ABLE study, for example, suggested that or found that men who molested girls average 19.8 victims, and men who molest boys average over 150 victims. I think 150.2. So. The reality is, in sexual abuse cases in particular, you often encounter defendants with significant hubris, and that's why, because they've done it a lot and gotten away with it a lot. But I don't know. That's just something that that stat triggered for me.
Thank you for that. And I'm eager to share the CAN information, so I'll move on quickly. Victims by race and ethnicity. I think what's important to note here is that we do have this data. So I hear frequently that we don't have this data on a state level. We do. And what we see is African American rate per 1,000 children in our state is 18.6, and the white rate of children is 18.5. Considering, I believe that it's around 3.4% of West Virginia's population is Black. It's clear to me that we need to be diverting more resources towards the Black community to deal with child victimization rates. And then maltreatment types of victims. I think what's really important to note here when we're looking at the types of victims is that we have a higher rate of physical abuse reported than we do of neglect. And one of the stats that's usually discussed when we talk about child maltreatment on the national level is that there are certainly more victims of neglect than there are physical abuse. But right here in these numbers in 2019, that does not pan out in West Virginia. Anything to add to that, Robert?
Yeah, I think that's fairly reflective of just anecdotally of practice as well. And neglect obviously, presents some serious issues as well. But most of the cases we seem to encounter, that seems roughly consistent.
Thank you. And then when we look at victims with caregiver risk factors of note, you would see the higher rate of drug abuse in West Virginia cases. To the right, you see the percentage of drug abuse with a caregiver risk factor, and that is 57.8%. That is the highest rate of any state in the country. And so clearly, drug abuse is playing a large role in a number of adverse disparities that our kids are experiencing, and one of them is child maltreatment. Clearly from the numbers. And so just this side note, and then we'll move on to some more data. If you get the report, you'll see some important notes from DHHR that are shared. And the one that I found most important to share is that they're working on a new data system that should help not only clean up, but share more data sets as we move forward, because it will be integrating different systems. And so it's called the PATH system. And I don't know if it is set up yet. We'll try and find that out. But I look forward to having more numbers that we can share as we move forward. Have you heard anything, Robert?
I have not.
Okay, so let's move on quickly here, and then we'll get to some great data that Robert has shared with us as well. So reports on the adoption of foster care analysis and reporting system, which is AFCARS, and NCANS data can be shared, it's shared collectively on AFCAR's website. And so if you're looking for numbers that are not just child welfare, but are in relationship with foster care, this is a great site to go to, and you can get, state specific numbers. As you see here, you can look at child maltreatment victims, you can get the foster care rate entry, children in foster care, and then children that are adopted. So it's a wealth of information that kind of marries those two systems together. Just be mindful that the 2019 data isn't up yet on AFCAR's website, but you can get the information in tables, and you can also get it in graphs. And so if you're looking for data for grant writing purposes, it's a really helpful website. And then, of course, we've all heard of Kids Count. It's been around, I can't remember how many years. It's national, and it's also statewide, and it has certain data sets that they report on annually. West Virginia has some emerging data, especially if you're looking to um, grant write on the effects of the drug crisis in West Virginia. They have some really important emerging indicators that would be helpful to you. But again, please note their child maltreatment data is again the NCANS data, and it is from 2018. So it hasn't incorporated the 2019 data. And we'll be happy to share the link to their database, Kids Count database, in the chat. And then we shared this. This is the 2019 Annual Statistics Report from the West Virginia court system. This is annual information that they report, and it is of juvenile cases by county. And so it's if you're writing something specifically for your community, it's really helpful information. It doesn't give a whole lot of information, but if you want to find out how many cases of child abuse and neglect, of delinquency, and of status offenses in your county for a particular year, it's a great place to go. And so with that, I'm going to hand the reins over to you, Robert.
Yeah, we one of the things that Kelly and I had talked about in terms of the takeaways is maybe some tools for grant writers. Came across this from the KC, I believe it's the KC Family Foundation. But this is a really cool tool. You have the URL up there, and I don't know if you can see on the left-hand side, but you can do a rectangle, a circle, or a free-form drawing around a specific area and pull some related data in a couple different categories. So I have highlighted some of the child and family metrics that might be interesting within a particular geographic region. If you're writing a grant for a particular county, city, or whatnot, you can see I've highlighted a particular area in Fairmont that has a pretty high poverty rate, at least in comparison to elsewhere. There's some demographic information as well. And you also have education, housing information, and things like that. But I thought that might be a really cool tool just from a grant writing perspective.
It is, I agree. So I added this slide, and hopefully we can get into a kind of a bigger conversation that you and I have pretty frequently, Robert, regarding what's going on with kids during the pandemic. And I caught this Associated Press story I think it's been about 2 weeks now, on the reporting of incidents of child abuse and neglect during the pandemic. And if you can't see the slide, we can put a link to it on our Facebook page afterwards. But there's been a significant drop in reports, which can be concerning. It doesn't mean specifically that all children have been in at-risk or dangerous places, but it certainly means that there could be a potential for that. And it's been over a year now. We do know in West Virginia that around 9,200 children didn't enroll in public education. It's been a decline in enrollment during this time period. And so that's really disconcerting as well. And is there anything before I move on to that you'd like to add, Robert?
No, well, I'll talk a little bit about it in just a second, but I agree. It doesn't. I think one thing to maybe frame what we're about to talk about in terms of the impact of COVID-19 is it'll probably be a while, right, before we have some really comprehensive data on this, and we can make more educated analysis of what occurred or didn't occur. But as you said, Kelly, there are some really concerning data points.
So you want to talk about West Virginia CAN data?
Yeah, so I have a couple particular pieces on the next slide I'd like to point out. Is there anything you'd like to talk about on this one particular?
No. I just thought that this was a really important source of information if people want to get a better understanding of child maltreatment in our state, and some specific numbers that they're not going to get from NCANs.
Yeah, West Virginia Child Advocacy Network, if you're not familiar with them, the coalition of several CACs located statewide that serve children who have been alleged to have been victims of abuse or neglect. And so this is really, really important data that they collected on what abuse looked like in West Virginia in 2019 through 2020. So we're going to explore that a little bit. There are a couple stats I found interesting, and maybe educational. All right, so right off the bat, there's a couple things that jump out here. And maybe before I delve into some specific stats from this report, I think we again need to reinforce, if you're watching this, you probably agree that facts matter, that data is important, and also that bad information that's put out there, or that circulates through the general public can really hurt kids. And I think one of the best examples of that is some of these really egregious cases dating back to the late 80s and early 90s that really harmed the trajectory of the child advocacy movement for a long time. The Kelly Michaels case, the McMartin cases, that still to this day, whether consciously or otherwise, infect many jury pools. There's this belief that child advocates or others are planting things in child's minds, and that children are really suggestible, and so they're making all these false allegations. Now, the data doesn't really bear that out. There are really, really great protocols in place when it comes to forensic interviews of children, ensuring those are conducted in a way that's scientifically defensible as well as legally defensible. There's always room for improvement, of course, and that should be sought. But nonetheless, there's this myth now in the jury pool that that's what child abuse investigations look like. And so it's a battle as a prosecutor, as an investigator, as a forensic interviewer. It's a battle to sort of dispel some of those myths. And I think right now, just in our current cultural moment, we have there's more danger of things like that. And I think the easy target would be conspiracy theories. Just conspiracy theories that you see float online. Oftentimes they're coming from a political lens, from a particular partisan lens that says this is what abuse looks like. Abuse is something that's perpetrated by the other, right? The other political party, the other demographic, something outside of my school or my church or my traditions. And that's not reality. I think we might have mentioned the darkness to light statistic earlier. 90% of children, and we're going to have one here that bears that out in West Virginia, 90% of children are abused by someone they know and someone they love. It's typically not this Illuminati group. It's not this evil cabal, though there are individuals that are powerful and abuse children. Abuse exists in all demographics, but that's not what it looks like. It looks like people that have proximity to children, that groom the child, that build trusting relationships with the child and those around the child. That's what abuse looks like. And so there's a lot of bad information out there on social media and elsewhere that we need to be aware of and address, because it hurts kids when those myths persist, and when a child story doesn't align with these false narratives that circulate online and elsewhere. So a couple things to emphasize. That third bullet down, I'll start there. 85% of alleged offenders in West Virginia, 85% were a parent, relative, or their partner. So a parent or relative of the child, or the parent or relative's partner. Again, it's the abuser, someone the child knows, someone the child loves, in the extreme majority of the time. I also want to focus on the stat in this graphic here that 56% of children served at West Virginia Child Advocacy Centers were there because of allegations of sexual abuse. And I think this is one of a couple data points that you pointed out, Kelly, where we diverge from the national, where neglect, though present in the report, I think something like 11%, if I'm remembering it correctly, though it's present in the report, it's not the majority of abuse that at least is encountered by CACs or documented by CACs. Now, there might be a couple reasons why that's the case. That doesn't necessarily equate to prevalence, but nonetheless, the majority of children who are served by CACs aren't there because of allegations of neglect. They're there because of allegations of sexual abuse, which I think is extremely significant. There are a couple pieces here. You'll note that there's an increase here in the last 5 years, 34% increase in children served in the last 5 years. I think that's consistent, Kelly, with the data you had earlier of that increase 2015 to 2019, so a steady increase there. Some of that is counterintuitively a good thing because it shows expansion of CACs and CAC services, so that's a good thing. Note that only 4% of alleged offenders were unknown, a stranger, as we said often. Here's sort of a surprising stat, and maybe this could be phrased better if I were a data scientist or you, Kelly. But one thing I found was interesting in the CAN report is that sexual abuse was disclosed by children twice as often as drug endangerment, which that would not have been my hypothesis, just from what we know of the drug crisis in West Virginia. Now, again, that doesn't equate to prevalence. There could be reasons why that's the case. Maybe drug endangerment cases, maybe those children aren't referred for forensic interviews as often, though they should be. If there's any sort of maltreatment, really, a child should be receiving a forensic interview. So maybe that's a function of it. But important to point out, so of the served children, 28% of the served children disclosed sexual abuse. 28% disclosed sexual abuse. 14% of the served children disclosed drug endangerment. Now, it was alleged for 19%. So 14 out of the 19% that it was alleged did disclose drug endangerment. So that suggests that children were fairly comfortable disclosing drug endangerment most of the time. That's not the case with sexual abuse. Even though sexual abuse was disclosed twice as often, so it was disclosed 28% of the time versus 14% of the time where drug endangerment was disclosed. Remember how much was alleged. Only 28% of the 56% of the allegations actually disclosed, which suggests that sexual abuse is probably harder to disclose than drug endangerment, which probably makes intuitive sense. Also note that we do have a higher drug endangerment rate in West Virginia than nationally. If you look in the CAN report, they've got these great columns for West Virginia stats as well as the corollaries on the national side. You see the drug endangerment was alleged for 19% of children the CAC served, whereas it was alleged for only 3% of children nationally. So that's a significant uptick.
These are really sterling statistics, Robert.
This goes with what you were saying earlier, Kelly. You see Jeremiah samples with DHHR. I mentioned CPS referrals down 8,000, down by 8,000 in 2020 due to the pandemic. I think samples had the correct takeaway. You see his quote here. He says, does that mean all of a sudden families are much better and these kids are no longer in risk? That'd be awesome. That'd be fantastic. But more likely it was an issue of detection. Another piece I think we need to be cognizant of in the pandemic is disappearing students. And this is a national problem, not just a state issue, though I know just talking with some counties, it's been an issue in at least some counties. Maybe you have better statewide data on this. But this is an article from actually just a month or so ago in the Washington Post, just laying out how even a year later, you have all these students that have just simply dropped off the radar, and there's a question of where they are, and some education officials working really hard to try to locate them. So in North Carolina, for example, an official said in December that more than 10,000 students hadn't been accounted for. New Mexico this year couldn't account for 12,000 students. Bellwether Education Partners back during the pandemic or during the height of the pandemic, they estimated 3 million students were missing from school in 2020, just across the nation. So again, many of these quite likely paperwork issues, right? This doesn't mean that every child is suddenly in imminent danger. Many of these are paperwork issues. Many of these are transition to homeschooling, and there's just some issue on the administrative side. But there are others where that wasn't the case, and you had teachers finding kids in really problematic situations. So another data point to be concerned about.
Yes, you and I have discussed this, and regardless of kind of the prevalence of kids in high risk environments until school gets back and we're on the other side of the pandemic, ensuring that we have kind of this coordinated effort to ensure that they get the resources they need once they're back in school or once they're connected back into a community is really important. We shouldn't wait to try and find out the validity of how the pandemic has adversely affected them before we respond.
Absolutely. Yep. All right, a few additional stats. Campbell had a couple interesting pieces. Naturally, intimate partner violence decreased significantly below the 2019 levels during the initial lockdowns, especially. But then you saw an uptick in domestic violence reports involving a weapon from June to August as the lockdowns eased a bit. You had an increase in homicides in many communities. I was talking to the Louisiana District Attorneys Association yesterday. I believe their homicide rate went up in the 40%. It was either 42% or 43% in Baton Rouge. Sort of a jarring stat from back in July, late July of last year. Domestic violence had killed more people than COVID in Alaska, which is just a jaw-dropping stat. We also saw a drastic increase in online sexual exploitation. And I could talk for a very long time, but I probably shouldn't about that because I really want to get to the predictive analytics piece. But there are some question marks, as you said, Kelly. There's some question marks on, okay, what is the comprehensive picture? What is the data going to show once we're totally out of the pandemic and we're able to really analyze things and see where the gaps are and make some educated analysis? One thing that is not up for debate, in my opinion, is that there was a huge increase in online sexual exploitation. And I think I could go to a single data point on that, though there are many. The NCMEC reports, the National Center for Missing and Exploited Children. They operate the cyber tip line in the United States, a little bit, some international intake as well. But if you go to March of 2019, there were a little under 1 million reports in that month of online sexual exploitation, which is an absurd number to begin with. But if you fast forward to March of 2020, when the lockdowns first went into place, then it doubles, it more than doubles to over 2 million. You go to April 2019 to April of 2020, it quadruples. Now, it didn't maintain that rate post-lockdown. It still was elevated from prior years, but just a tidal wave. And there's a variety of other individuals who concurred with this. Interpol talked about an uptick in increased sharing of child sexual abuse material online as offenders were in lockdown and bored. NPR published a piece called Child Sexual Abuse Live Streams Increase During Coronavirus Lockdowns. So children being abused over Zoom. Just a whole host of issues. Great Britain had a huge issue with the live streaming abuse. They arrested numerous individuals who were logging into Zoom and directing in real time the sexual exploitation of children in Thailand and the Philippines, and they would pay for that. And it got a good bit of coverage because these individuals got about 2 years in jail on average for those types of offenses, despite that direct role. I think it's another issue when we get into predator dark web forums. Here's the thing: we might debate about increase or not increase. Who's not debating it are predators on dark websites. If you're not familiar with this concept, there are websites on the dark web. They have their anonymization platforms, so it's harder to detect and track material that's exchanged and location and things like that. But in addition to exchanging material, images and videos depicting abuse of children, including abuse of toddlers and infants, in addition to those horrific pieces being exchanged, there's communities, there's forums where they discuss how to groom a child, how to groom people around the child, how to abuse a child with impunity. And one thing these contributors on these forums were saying is about the pandemic and about the opportunity of the pandemic and children being isolated and children not having access to others and children not being able to disclose abuse. So they know it, they knew it, and they were taking advantage of it. And so a whole host of concerns there as well that we could talk about for quite a bit, but we should probably jump ahead to our next slide.
Let's move ahead, but let's talk again about that at a later date because it's really important.
So I thought this was a really interesting guide, DHHS's 2021-2022 Prevention Resource Guide. They had a couple recommendations that I thought were really interesting in terms of utilizing data, leveraging data to prevent child abuse and neglect, not just to document it, not just to analyze it, but to proactively prevent it, which I love. So one of the recommendations was expand data sharing among organizations. If you work in child protection or advocacy or nonprofits, this might shock you. There are silos, and that's not a good thing, right? So breaking down those silos was a key recommendation, and certainly something we need to do. Obviously, being cognizant of confidentiality issues and the whole host of logistical issues, security that accompany that. Second, they recommended reviewing and presenting data with a racial equity lens, and this is particularly important when we talk, as we will, about artificial intelligence, machine learning, predictive models, particularly important. You don't want to be reinforcing systemic bias. You don't want to be reinforcing racial injustice as you try to be more proactive. So that's a critical piece. Racial equity tools has some really interesting resources out there. If you just Google racial equity tools, there's some interesting pieces there. Using data mapping, ethical uses of predictive analytics, I'll talk about in a second. Using data mapping, so basically it is what it sounds like. You have maps, you put data on the maps, and you find out some really interesting things about abuse prevalence and also how you can target prevention efforts. One of the key issues that we face, and we touched on a couple times, is resource scarcity, right? Investigators not having optimal resources, nonprofits not having optimal resources, or optimal funding, certainly. So how do we target our resources in a way that really meaningfully moves the needle on prevention, and then tracking this well-being over time, putting efforts where they need to be. This is just a fascinating article. If you'd like to delve more into the potential of artificial intelligence in the child welfare system specifically, I was fascinated by this article by Jacqueline Schaefer, Harnessing AI Innovation for Struggling Families. She talks about a couple case studies where child welfare systems in a couple different states have made some really interesting progress on reducing backlogs on the administrative piece, but also some innovative spaces as well. I think importantly, she also presents some caution about using AI, again, dealing with those issues of bias. These have to be really well trained and whatnot. So it's worthy of caution, but there are also some really interesting success stories in here that I think we would do well to learn from in West Virginia.
You know, I completely agree with you in that we really need to be focusing the precious few resources that we do have in targeted areas in ways that we would get the most response, right? So we have an actual plan using data to meaningfully respond to the need.
Exactly. All right, this is, I know we've gone over, but can we still play it, Kelly?
Sure.
This is just a quick 3-minute clip, so we'll discuss in a second.
In an urban setting, the smallest we've gotten is down to about 400 by 400 square feet, but typically we're at about 1,000 by 1,000. So on the left-hand side here, what you see is the grid over the city, and the purple squares are representing rivers or parks, areas, places where people don't live. So we're not going to include those in the analysis. Then we're looking to see what the maltreatment event rate per 100 people is by grid cell to see if there is clustering of child maltreatment. And if there are statistically significant maltreatment clusters in the city, then we know that we can move on to the next step, which is feature engineering. So what are we going to include as our predictor variables or independent variables? Well, the theory behind all of this is that in these small areas that are bigger than a household but smaller than a neighborhood, if there is increased child maltreatment risk that is related to exposure, But the things that people in those areas are experiencing are things like, having an accumulation of adverse childhood experiences. There can be enabling or criminogenic infrastructure, unmet critical needs and capabilities, unhealthy social norms, and social isolation. Now, this exposure is going to create the adaptations and maladaptations that are related to adverse childhood experiences and social determinants. And so we're going to see things in children that grow up in these environments that include, the epigenetic modifications and the neurodevelopmental maladaptations, altered stress and immune response, impaired executive functioning, emotional reactivity. All of these things are going to be more likely to occur in a population that is heavily exposed to these other things. And this is, of course, going to lead to all of the outcomes that we are all trying to prevent and that are also risk factors for child maltreatment. So if we're talking about prevention, prediction or prevention, we have to consider each of these things, each of these exposure, adaptation, and outcomes as part of the picture. And when we're planning for prevention, we need to make sure that whatever it is that we're doing to try to prevent these outcomes or to manage these outcomes doesn't actually increase exposure to the children living in the same environment. So knowing that, the predictor variables or the risk features that we're going to include in the exploratory analysis and feature engineering stage of this are things like criminogenic infrastructure. So from the criminology literature, there's a long list of types of locations that are criminogenic or crime attracting. So for example, we know that laundromats are attractors of aggravated assault. We know that car washes can be attractors of drug trade. So we include those in the next step. We also include potentially protective infrastructure. So anything that could be protective of the community or offer services that would protect the community. So things like safe communities, fire stations, libraries, community centers, anything that could be used for prevention.
So that's fascinating stuff to me. And I think that's where we need to go, right? I think that's where we need to get in terms of resource targeting. So that's an organization called Predict, Align, Prevent. They're referenced in that prevention resource guide from DHHS, the 2021-2022, and there are links in that report, or you can go to www.predict-align-prevent. I think I might have an address on the next slide potentially. But I think this is really good stuff. So that website has a line that once we learn where children are most vulnerable to maltreatment and related fatality, we can then align resources precisely where they'll do the most good. And so this has been implemented, I think, solely in urban context to this point, Richmond, DC, but also Little Rock, Arkansas. In Little Rock, I found interesting, they discovered that 53%, so more than half of all preventable child deaths in Little Rock occurred in 15% of the city where child maltreatment risk was the highest. And all child maltreatment fatalities occurred in the two highest risk areas of the city. So if you're trying to move the needle, being able to target those specific areas, gather stakeholders that are pertinent to those specific areas, that could be really critical. And we've talked about this resource issue. We don't have resources to blanket everything, though we wish we did, and maybe we should work for that. But I think there's just tremendous potential here towards being much more proactive. Abuse can be ended. As I said, my day job is Zero Abuse Project. It's not a cliche. Abuse can be ended, much like polio or other diseases were drastically reduced, if not eliminated. What does it take? In those cases, it took epidemiology. Same issue here. It takes data-informed prevention efforts. It takes data-informed intervention strategies. That's how you wipe out abuse, and that's the way we should go.
That is such interesting stuff. We did this, we're still doing this community assessment around the 6 counties where I live in Charleston. And one of the things that we just heard over and over again was, the kids have, no sense of community. They have nowhere to go. They don't have those protective factors in their community, right? And so it seems to me like such an important marriage of data and anecdotal information to try and plot a strategic way to address child maltreatment in our state. And so with that, Andrea, did we get any questions?
We just got a lot of comments, but one thing that you need to know is the new data collection system for DHHR. We got a comment that it's likely to go live in July.
Well, how wonderful is that?
Yeah, and also excellent presentation. This really was good, guys. This was fabulous. Thank you so much.
Well, that was great to hear. Robert, I am always so thankful for your time and expertise. And hope we can do this again as we try and use data to chart a path towards reducing child maltreatment in West Virginia.
Absolutely. Look forward to it.
Great. Thank you, Andrea.
You're welcome.
Have a good day, everyone. And we'll shoot all of the links of the pages that we discussed and data sources in Facebook. And if you know anyone who isn't on Facebook but would find this meaningful information, we will have this video up on our YouTube channel tomorrow. Have a good day, everyone.